Hello everyone, this is the part 1 of video series which discusses about post-COVID sequelae or it is also known as long COVID-19. How to diagnose post-COVID sequelae? Any symptoms or health issues which persist beyond 4 weeks of initial infection we can label it as post-COVID sequelae. How to calculate it or how to diagnose it? So you take the first day of your any of the symptom like fever, body ache, or cough as a day one, the first day of symptom appearance. From there you calculate 28 days. Beyond 28 days, any symptoms is there, we label it as post-COVID sequelae. Post-COVID sequelae can involve multiple organ systems, like it can involve lungs, heart, and dermatological part like skin and nervous system and psychiatric system and also endocrinology systems. This post-COVID sequelae can also present with post-COVID sequelae can also can give rise to some autoimmune diseases and also a multisystem inflammatory syndrome in adults also and especially in children where we call it as MISC. Although the symptoms can be of long hospitalization, they not necessarily secondary to COVID-19, but if the person is staying in the ICU for a long time or on ventilator for a long time, they can have respiratory muscle weakness, they can have some condition known as deconditioning, and they can have some post-intensive care patients who are put on to mechanical ventilation where the intubation has been done. That can cause a problem with the windpipe, also known as trachea. That becomes strictured and it becomes very small, what we call as tracheal stenosis. Many of the patients can come back after 4 weeks with complaints of chest tightness and chest heaviness, and they also complain of breathing difficulty if they do small physical excursions. So this all could be due to extensive fibrosis which can occur with severe or critical COVID-19 pneumonia. The pulmonary fibrosis means the normal oxygen exchanging units of the lung becomes like a wood. It becomes impermeable for blood circulation as well as the oxygen transfusion or oxygen exchange and with carbon dioxide. So extensive fibrosis can decrease oxygenation permanently, and these symptoms of breathing difficulty can exist beyond 4 weeks. Fungal infections like pulmonary aspergillus and mucormycosis, what we in India commonly call as black fungus, and invasive candidial infection can be present. Fungal infections can present after 4 weeks of initial symptom. Many patients do come with the problem of persisting breathing difficulty. When you check their blood oxygenation level with using a pulse oximeter, it will be more than 95%, but they still feel difficulty in breathing. The reason is it is because of the prolonged illness or the COVID-19 infection which has occurred. There is a respiratory muscle weakness, and also a deconditioning after the recovery can also contribute to difficulty in breathing, even though oxygen level. If you see in the cardiovascular system, or many of these patients after recovery beyond 4 weeks can come with symptoms of palpitation, means feeling own heartbeat which is running very fast. This palpitation can linger on even beyond. If you take nervous system, there could be stroke beyond 4 weeks of COVID-19 infection or cerebrovascular accident, what we call. This is because of excessive thrombosis, small thrombosis. Thrombosis is nothing but blood clots. As we all know that during COVID-19 that they increase the risk of blood clots, but it can extend even when they recover in the post-COVID sequelae time beyond 4 weeks. So in post-COVID sequelae, this loss of smell and taste can persist. It can persist for the period of multiple weeks. Also, it can persist multiple months, even up to a year time. Many psychiatry symptoms can also appear beyond 4 weeks of COVID-19 infection. They are like anxiety, depression, and mood changes, and many people struggle to get proper sleep. In the endocrinology system, which deals with hormones, the problem could be new onset diabetes. We are seeing many post-COVID patients beyond 4 weeks developing new onset diabetes. This is the first part of the post-COVID sequelae or long COVID. In subsequent parts, I will be discussing about how to recognize the symptoms of post-COVID sequelae and how to deal them. Thank you.